What if I told you a tablet, not a transfusion, not gene therapy, that could reduce lifelong blood transfusions in thalassemia? Would you believe that? No, right? But there is uncomfortable truth. This drug is powerful and misunderstood. On December 23rd, 2025, the FDA quietly approved Aqvesme, Mitapivat generic soil tablet for beta thalassemia. No flashy ads, no celebrity reels, but inside the hospital pharmacies and hematology clinic, this approval is big. Let's find out why. Hi, my name is Mayank. I am registered pharmacist with RX Indian Pharmacist channel, your go-to guide to pharmacy knowledge. If you're new to this channel, consider subscribing. If you're being patient, diagnosed with thalassemia, you could expect lifelong transfusions, iron overload, chelation therapy, fatigue, hospital visits, and financial stress. And suddenly, an oral metabolic drug enters the picture. That's Aqvesme. So yes, patient should care. Pharmacists must care. Let me speak as a pharmacist to human for a moment. Thalassemia patients don't just fight anemia. They also fight endless transfusion schedules, iron toxicity, damaging heart and liver, fear of missing one hospital visit, a life planned around hemoglobin numbers. And for healthcare professionals, they could be flooded with multiple questions. Is this a cure? Can I stop my transfusion forever? Is this a gene therapy in a pill? What is it? They get a lot of questions from patients around them and enthusiasts. That confusion is dangerous. If Aqvesme is treated like a miracle pill, patient may stop transfusions early. Patients could stop transfusions too early. Expectations could crash to non-adherence of the regime. Side effects get ignored, drug interactions get missed, and the biggest risk could be a good drug could get blamed for bad education. Let's slow down and talk real science for a moment. Therapeutic action. Beta thalassemia is of two types, transfusion dependent and non-transfusion dependent. Let's understand the mechanism of action. Mitapivat is a pyruvate kinase activator. Red blood cells are likely tiny engines. In thalassemia, those engines are weak and inefficient. Mitapivat boosts energy, ATP inside the RBC, improves RBC survival, reduces premature breakdown that is called as hemolysis. It helps increase higher hemoglobin levels in the blood. Important warning, this doesn't fix the gene. It makes existing red cells work better and live longer. That's the magic of this drug and the limitation as well. So let's understand what are the side effects. FDA-labeled side effects are most reported side effects include headache, insomnia, nausea, abdominal discomfort, fatigue, metabolic lab changes like as in liver enzyme, ALT and AST could get elevated. Uric acid could get elevated as well in the report. Gout risk in predisposed patients could occur. Serious but less common side effect could be hepatotoxicity. If that occurs, requires continuous monitoring. Risk of withdrawal anemia if stopped abruptly. Pharmacists should take a note. This is not a start and forget drug. Now let's understand what are the drug interactions. Mitapivat is a CYP enzyme inducer. It can reduce effectiveness of hormonal contraceptive, warfarin, certain antifungals, immunosuppressant, some antiviral. Backup contraception is required if those occur. Also, avoid strong CYP inducers without adjustment. Caution in hepatic impaired patients. This is where pharmacist education saves lives. After this video, I want you to think differently. From prospect of patient, ask your doctor, am I transfusion dependent or not? What hemoglobin target are we aiming for? How often will labs be monitored? What drugs or supplements should I stop? And on the other hand, if you are a healthcare provider or pharmacist or pharmacy student, treat Aqvesme like a metabolic modulator, not a cure. Educate on expectation management. Monitor laboratory reports like LFTs, uric acid, drug interaction. Protect patients from TikTok misinformation. So, if you like this video, consider giving it a thumbs up. Subscribe to my channel, RX Indian Pharmacist, your go-to guide to pharmacy knowledge. See you next week in another video like this. Until then, bye for now.